Thank you. It's all right. No, it's optional. This is optional. It's about 20 minutes, not even. Okay, so this is the second part of our Eclectic Evangelism series. And you might say, Reverend Ramona, why are you doing this series? Well, this series is about, today is about food insecurity and the economics of food. And you might say, Reverend Ramona, why are you doing this? And what I'd say is that food and food security is a passion for me. And in my previous life, before I became a priest, I was the director of the Supplemental Nutrition Assistance Program, what used to be called food stamps, at the state of Minnesota. And I did that job for 15 years. And when I was there, there were 400,000 to 500,000 people a month receiving SNAP benefits, food stamp benefits in the state of Minnesota. And I've also worked on legislation to help more people get food stamp benefits over the years. And so to me, the right to eat is a right for everyone. It's not an entitlement per se. I often think about the economics of food. And really for me, I felt like you can talk a lot about it, but really what it is about is who gets to eat and who doesn't, who is worthy to eat and who isn't worthy to eat. And for a while here in Minnesota, before we passed some legislation, who got to eat was based on whether you were able-bodied or not. And so if someone categorized you as able-bodied and you didn't have kids, you were only allowed to eat to get SNAP benefits 3 months out of a 12-month period. What we found out was most of those folks who were considered able-bodied were not able-bodied. They had perhaps some mental health issues, homelessness, addiction issues, and on and on and on. So that sort of explains my commitment to food programs and making sure that the right to food is a human right and not who gets to eat and who doesn't. From a biblical perspective, if we look at Isaiah says, if you give some of your own food to feed those who are hungry and to satisfy the needs of those who are humble, then your light will rise in the dark and your darkness will become as bright as the noonday sun. Share your food with the hungry and give shelter to the homeless. And then in Matthew, one of Jesus' 2 feeding miracles in the Gospels, Jesus said to them, they do not need to go away. You give them something to eat. You know, the miracle of feeding the 5,000. And then, of course, Matthew says, I was hungry and you gave me something to eat. And I was thirsty and you gave me something to drink. So those are some examples of why, as followers of Jesus, we're called to feed the hungry. So let's talk very briefly about the economics of food. I mentioned it before. It's about who gets to eat and who doesn't get to eat. The unworthy poor. You don't get to eat because, and you can name your trait, you're lazy, you're drunk, you're crazy, you take drugs, you spend your money on cigarettes. So those are the reasons sometimes we hear about food not being available to certain people. But if you look at the numbers of hunger, let's just think worldwide for a second. 690 million people are hungry in the world. That's 8.9% of the world population. These numbers are coming from the United Nations. So that given issues with climate change and COVID also, but up to 10 million people in 1 year, that number went up, and it will go up nearly 60 million people in 5 years. So people who have hunger or food insecurity in their lives. The majority of those who don't have food are in Asia and Africa. In Asia, 381 million people have food insecurity. And in Africa, 250 million people have food insecurity. So you remember my friend, Reverend Simeon, who was from Burundi. He joined us sometimes on Zoom. He was going to school down at the Sewanee Seminary in Tennessee. He was here in the United States for 2 years for COVID, separated from his family. He and I write to each other, via email and Facebook. I had an email from him the other day. Burundi is the poorest country in Africa. It is the poorest country. I asked him how he and his family were doing. Now, he is a priest. He does get a small stipend from the diocese. He said he and his wife and child and a relative who lives with them are lucky if they can get 2 meals a day. They're lucky. He said most of his parishioners are, it's the dry season there and it's the famine season there. And most of his parishioners are barely getting 1 meal a day. And there is vast malnutrition, and particularly in children. Now, think about this. On a worldwide scale, we have enough food to feed the world, right? We have enough food to feed the world. And yet, this country in Burundi, Africa, the poorest country in the world, has food shortages. You find that, in many places in the world that there are food shortages. Here in our own country, in the United States, 35 million Americans live in households that struggle against hunger. 35 million. That's 1 in 10 households in the US. 1 in 10. We're supposed to be the most abundant country in the world. We throw food out. We throw it out. We let it rot. Our kids aren't getting the food that they need. 1 in 8 households with kids can't buy enough food for their families. 1 in 8. We know from all the research, when kids are fed a proper diet, they do better. They do better in school. They do better in terms of their growth. They do better in terms of their nutrition and their lifelong outcomes around health and earnings and all those things. We know that they do better. And yet we have all these kids going hungry. There is a certain racism that exists in food insecurity. We know in the United States that African American households have 19.1% times the rate of food insecurity as white households. And the highest rates of food insecurity are in the South, followed by the Midwest, right here, in the Midwest and West and Northeast. And it varies from state by state. The least amount of food security is in New Hampshire, about 6%, and the most is in Mississippi, 15.7%. So we've talked about world hunger, we've talked about US hunger, let's talk about Minnesota hunger. I've been in Minnesota for 40 years. I've been here in the incredible place where everyone has enough homes and all those things. As I've spent my time here, I know that the economics of our state have changed over time. Under by the numbers here in Minnesota, 5.5 and a half million people is on poverty. 5.5 million people. But 1 in 10 households has hunger and food insecurity. That's about 500,000 people. And the majority of hunger, people sometimes don't think that there's hunger in rural areas, and also in urban areas as well. So there are a number of programs in Minnesota that federal program comes with federal dollars. So that program doesn't cost the state anything to run. There is another program, and that is to help people with their nutrition. The average amount of money that people get, people think, people go in with their little card, their food benefit card, and people think, oh, they're getting all this free food and they're buying ice cream and they're buying candies and that sort of thing. But the average benefit that a person gets is about $110 a month. Now you try and eat on $110 a month. And that amount that people get is based on something called the Thrifty Food Plan, which was something that was invented in the 1960s that was supposed to be indexed to inflation. It doesn't work very well. So it's meant to take care of a person's food needs about 2/3 of it. So 66% of a month maybe included. And then the other 33% of the month to figure that out on your own. Majority of people who receive SNAP benefits are working people. They're working people. Elders receive it as well, and kids. Kids have to get healthy food into their lives. There's other programs you've probably heard of. There's WIC, which is Women, Infants, and Children, and that provides food for nursing women, for women with kids. There's certain things. You've probably seen the signs in the stores. We take WIC vouchers, WIC coupons. They're getting cereal and milk and juice and eggs and things that kids need and nursing and pregnant women to build healthy bodies. And there are commodity programs where we dump cheese and milk and all these things and butter. But there are some programs where you can go and get those products for your family instead of those being dumped. The state of hunger right now in Minnesota, I told you about 500,000 people have food insecurity. So there are about 386,000 Minnesotans who receive some sort of nutrition assistance, which means about 150,000 people who could be getting it, who aren't getting it. And for some, that's a matter of pride. They don't want that help. For some, it's a matter of they don't know how to get it. And for some, they can't manage to navigate the system. So, if you do know someone who might be having food insecurity, they simply have to apply. They call their county. I think most of the applications right now are taken over the phone. You have to provide some proofs of things. And there is an income limit, but again, if you need food, even if you're only entitled to $15, like for elders, there's no limit on income for elders. And so, assets, what you have in the bank. So even $15, you can buy some food for $15. You can buy a bag of food for $15. And I think that can go a long way to help with nutrition. So these are some of the examples around what's going on in Minnesota. Minnesota has 32 community action organizations that work on hunger relief. And maybe some of you have worked with them here. The Harvest, Second Harvest, Feed My Starving Children, Harvest Pack. Anyway, there's a lot of these community action agencies who are closest to the communities that need their help. And so you don't have to reinvent the wheel in terms of setting up an individual food shelf. There are also a number of churches and agencies who specifically work with food shelves to help them get food. Which brings me to the last part of my presentation. I want to talk about the importance of food shelves. Here in Minnesota, food shelves have over 3 million visits a year. 3 million visits for people who need food. Remember how I told you that if you're on SNAP, that covers about 66% of your food needs in a given month if you're really careful and on this thrifty food plan kind of thing, which most people can't do. So the need for food stamps increases, or the need for food shelves increases rapidly. I live in Burnsville. There's this church called the Vineyard Church behind my house. On Monday, they give away boxes of food. They start giving food away at 4 o'clock in the afternoon. Cars start to line up at 2 o'clock in the afternoon, car after car after car. They snake around in a huge parking lot, they snake down the street, and then snake out onto the Gambler's Road. An incredible need for food in the suburbs in Burnsville. So it's real. It's very, very real. Children who get some services from food shelf, over 1 million kids per year. 1 million kids being helped on the food shelf. And food shelves have about 9,000 visits per day throughout the state. So they're very much a part of the economy that helps people eat. Which brings me to the last part of my presentation. Oh, I wanted to talk about one more thing. Food deserts. So there are places throughout the Twin Cities where there is not a grocery store on public transportation routes or on in walking distance. They're just not there. In some neighborhoods, the stores have closed. You know, some of the bigger stores, Cub, Rainbow, they used to be in, you know, maybe in city areas, they're not there anymore. That's a food desert. In rural areas where people have to go miles and miles to find a grocery store, that's a food desert. What happens in food deserts is convenience stores spring up. Not that it's a bad idea because they serve the community, but the prices can be higher, and also the availability of healthy food may not be there. I served on the Prairie Island Indian Reservation as a priest for 2 years and a security supply. There is not one grocery store on the Prairie Island Indian Reservation. People had to go into Redmond. People had to go into Redmond to get their food, to get groceries. The convenience store, nice convenience store, but what was in there? Chips, pop, candy, snacks, hot dogs, hamburgers, junk, right? Junk. But there's a program that said at convenience stores, if you will stock healthy food, and if you will put it right up in front where people come in the store, we will give you a refrigerator case for free. So if you were taking SNAP benefits, the government would give you this refrigerator case for free, just have it plugged in, and promise to stock it with fruits and vegetables and that sort of thing. It works. There's also a deal at the farmer's market where you can take your EBT card, you go to the cashier at the front, you get these tokens because not every vendor can take an EBT card, and then you can buy fresh fruits and vegetables. So there are ways of getting nutritious food into the hands of people. So, food shelves. We have an opportunity here at the church. I talked with the outreach team about this at the meeting, and they are in agreement. During Advent, what we'd like to do is have a Share the Abundance food drive for parishioners at St. Nicholas. St. Nicholas has a large Latino Hispanic congregation. Many were affected by COVID. They often will work lower paid jobs, and they are very, very much in need of food. And we thought that part of our Advent giving, and kind of in the spirit of abundance, is that each of the 24 days of Advent, we would put something that is needed by St. Nicholas into a bag. So, for instance, some of the food has a cultural significance to it. Rice in the bag, refried beans in the bag, sugar and flour in the bag, masa, which they used to make tortillas, in the bag. And there's a list that we all have for everyone to be able to take that list. And then each day, in a mindful way, put something in the bag instead of an Advent calendar where you're taking chocolate. You go ahead and have a calendar if you want, chocolate. Instead of taking the chocolate out, I'll take the chocolate out and put something into the food shelf and bring it on Sunday. There are baskets in the back marked with contributions for the food shelf. And so I'd really, really like you to think about doing that as your Advent discipline. So thank you for letting me share with you a little bit about what's going on with hunger. It is a political issue. It is an economic issue. It is a world issue. It is a climate issue. And what it really comes down to is who gets to eat that basis. So please keep that in mind as you think about what your Advent giving might be.
That makes it our issue.
It is our issue. It is our issue. And we don't know. We don't know when people are hungry. We don't know. Because people sometimes feel ashamed that they're hungry, that they can't feed their kids. We may never, ever know that someone's hungry, but people are hungry. I came from an Italian family. My grandmother fed half the neighborhood. If someone was hungry, she'd say, "Come in, sit down." And she'd put out whatever she had for them to eat. And I know many of you have come from backgrounds